And welcome back. Sleep apnea is a common yet sometimes dangerous sleep disorder. It affects men, women, and even children.
But many people who have the disorder either don't know it or are hesitant to treat it. So here to explain a little more is a board-certified ear, nose, and throat specialist, Dr. Madan Kandula from Advent. Good to see you again.
Good to be here. Thank you.
Nice to have you.
Yeah, I think this is an important topic to talk about because there's a lot of people in America who have sleep apnea who don't know it, right?
Yep, absolutely.
How many people do you think there are?
The statistics show about 25% of adult males have sleep apnea and about 10% of adult females.
Wow.
Now, if you think about people you know, do a quarter of the guys that you know, do they have sleep apnea? Are they getting treated for it? And the same thing as far as 10th of females? And I'd say no. I mean, so it's very, very underdiagnosed. It's been much more recognized here recently in the last few years, but there's most folks who have sleep apnea, by a large majority, don't know it, aren't getting treated, and that's a problem.
Well, and I think the thing is, I mean, it sounds like pointing out the obvious, but the reason we may not know we have sleep apnea is because we're sleeping when the symptoms present themselves. So usually it's probably a partner who's like, dude, when you sleep, there's something wrong.
Something's wrong, exactly. And we've talked about in the past, it's all relative, but if you're sleeping next to somebody who has got sleep apnea, it's usually a pretty obvious problem, and not necessarily to them unless or until they get treated for it, but it's a big deal, and snoring's the big key. Most people, well, pretty much everybody who's got sleep apnea snores, almost 100%. Not everybody who snores has sleep apnea. There's things that we can do for snores. There's things that we can do for sleep apnea sufferers. First thing is we got to know what's going on.
If somebody has sleep apnea, what kind of problems might it present for them health-wise? I mean, what are they looking at as
there's things that happen to them when they're tired. They're more at risk for accidents. It's like walking around during the day in a haze every day, day after day. Lots of mood issues, and it affects everything. It affects relationships, affects their quality of life. There's nothing good about it. In the long run, folks who have sleep apnea and aren't getting treated, their risks of heart attacks and strokes go up by 6 to 8 times what normal people would have, which is a bad deal. And so you're not gonna, if you have sleep apnea, you're not likely to die in the middle of the night. But if that goes on year after year, day after day, then eventually it's going to do you in.
I think Reggie White's death brought a lot of attention to sleep apnea because they attributed it to complications related to sleep apnea.
Absolutely.
I know that one of the ways that you diagnose sleep apnea is having people come in for an overnight sleep study. They can do that in a hospital. They can do it in a sleep laboratory. That's been used for a long time, really, to diagnose the disorder. But are there other methods or ways that you can tell if somebody has a problem?
Yeah, I mean, the sleep study is the gold standard. There are ways, the standard ways to do it in a sleep lab. We can do it in a home sleep study these days, which is very low key, and it lowers the barrier, lowers the threshold for somebody to get treated. Lots of people, they're in denial or they're just embarrassed. I mean, nobody wants to be a snorer or be known as a snorer. There's nothing glamorous about it. And so getting treated is sort of, there's a inertia effect as far as doing something about it. So to lower the threshold to do something really helps. The other thing, I think lots of folks are sort of fearful of the treatment for sleep apnea. Most people I think have seen CPAP machines, have heard about them these days, and the same thing, it's not glamorous, it's not sexy, it just isn't. Now, it's treating a medical problem, but that's not the only way to treat it, which is an important point as well.
Well, yeah, let's talk about that, because CPAP, like you said, the CPAP machine is what a lot of people think of when they think of treating sleep apnea. What alternatives are there? Are there good ones that match it?
Absolutely. There are. I mean, the CPAP machine is the gold standard, and what that's doing is a machine that's pushing air in, keeping your airway open so it's not able to collapse. There are ways we can do that surgically, so we can surgically either stiffen tissue so that that's not happening, or actually remove tissue so that we're opening up the airway. There are things called dental appliances or oral appliances that allow us to keep the airway open. Lots of folks, unfortunately, kind of get sort of railroaded down one pathway, and if that's a proper pathway for them, that's great. But if it's not, it's not. And a lot of times, unless somebody's actually looking and kind of trying to quantify the issues and qualify the issues, that's our chance to actually really get somebody on the right road.
I know that you do not provide CPAP treatment, but you make referrals for that. One of the things that you do to sometimes correct this problem is something called the Hiller procedure, right? And that's done to the that's different. I was just talking about implants into the throat, this different area up. So that
really kind of tighten the tissue up. Now, some folks are great candidates for that, and some folks are awful candidates for that. And same thing with a CPAP. I mean, the CPAP, some folks are great candidates and other folks aren't. A lot of those issues revolve around, or the reasons why somebody's a good candidate or bad candidate is based on their sleep study. A lot of it is based on how their anatomy looks. What do things look like in the back of the throat? Is it possible to stiffen that area up, or is it just going to be, sort of not going to work for them? And so really, a lot of folks come to see me because we don't provide CPAP machines. I certainly refer folks out that need that, but a lot of folks are sort of a little bit leery. They feel like it's kind of a little bit of a shell game with the sleep labs and the CPAP machines, and it's not for the most part, but I think getting a sort of non-biased opinion is a lot of times helpful.
I think so too.
Yeah, we're out of time. I want to mention that you do have a free snoring app, so people can download that on their smartphone, learn a little bit more about snoring and how that relates to sleep apnea and other sleep disorders. Here's where you can contact Advent at. They're located on North Mayfair Road. The phone number on your screen to call for more information is 414-771-6780 or visit advent.md. You have a great place. I love
Thank you.
I love what you do.
Thank you very much.
Thank you so much. Nice to have you back this morning.